So once again, good evening and good morning to all of you from wherever the part of the world you are joining from. Very warm welcome to you to the Chronic Pain Reversal Program. So I am Bala, a host for the day. I am from Reach Healthcare. Our brand Integrated Wellness Science and Practice is hosting this event. So we have Dr. Shruti Sridhar and Ms. Swati Sridhar with us. They are going to take you through the program. So a quick introduction about them before we start the program. Dr. Shruti is our integrated medicine practitioner. She holds dual degrees, MBBS and MF in homeopathy. She is also in an MPH. Swati Sridhar, she is our yoga therapist. She has done 100 hours of yoga training TTC in the Yoga Institute, Mumbai. And both of them, Dr. Shruti Sridhar and Dr. Swati, Ms. Swati, are going to take you through our unique approach of treating chronic pain. So end of the program, you will probably realize that what we are talking is completely unique and is generally not practiced elsewhere. So without wasting much of time, I would hand it over to Dr. Shruti. Before that, a couple of requests to all of you. So kindly mute yourself throughout the program. And as and when you get a question or any query to be asked, kindly put that in the chat box. So end of the presentation, Dr. Shruti and Ms. Swati will run through all the questions and address it. Thank you so much. So over to you, Dr. Shruti.
Thank you. Thank you for the introduction, Bala. And good evening, everybody. Good morning from wherever you're joining in. I am very excited to present this presentation today because it's a lot of my hard work that I've done over the last 5 years, treating patients, understanding their problem, getting to the root cause of their problem, and trying to solve it in a more holistic and a permanent manner rather than just superficially treating it. So I'm not going to waste a lot of time because this is a big presentation and I want to finish it soon so that I can take up questions. Bala, my screen is visible?
Yes, doctor. Your screen is
Okay.
visible. Yeah, please
All
go ahead.
right. So this program is specifically designed for people suffering with chronic pain, and it is specifically non-cancer pain. So anything other than cancer which is causing chronic pain they can be benefited by participating in our program. So just to run through the general diagnoses that can be helped, one is chronic musculoskeletal pain, which is very, very common, basically because of sedentary lifestyle and lack of exercise, lack of stretching, stress, irritable bowel syndrome, fibromyalgia, cluster headaches, migraines, chronic lower back pain, arthritis, complex pain syndrome, chronic pelvic pain, pain due to sports injuries. A lot of the times, if there are any athletes in the talk today listening to me, you will know that there are a lot of injuries which happen during practice, during the event, even post the event. And this program will help even for those people who are suffering from sports injuries. Chronic pain post surgery, which is specifically seen after lower back pain surgery. Depression associated with chronic pain, anxiety disorder associated with chronic pain, chronic inflammatory conditions, Crohn's disease, ankylosing spondylitis, and chronic fatigue. Now, this list is not exhaustive. As I said, non-cancer pain, any pain which is coming under non-cancer can be benefited from this program. And in this video or in this presentation today, I'll be taking you through the whole concept, like how it came and how we are going to address the problem. So you will also get an idea of how you will be benefited by this. So what are the objectives of this program is, one is to understand the mechanisms of chronic pain, like why does chronic pain happen? Second is to understand the underlying causes that lead to chronic pain. If you just paid attention to the previous slide, I gave you like a list of 15-20 diagnoses. But all of these diagnoses have one thing in common, that is they have chronic pain. That is their presenting symptom. right? So even though the symptom is pain, the underlying causes can be many and they have to be addressed. Integrative approach to address the root cause of the pain, reduce dependency on pain medications, and to improve quality of life. All right, so this is the objectives of the program, and towards the end of the talk, Bala will take you through the different components of it and how we are going to go about it. So now let's understand what is the purpose of pain, right? So first, let me talk about acute pain, and then we will get into chronic pain. So the first necessity of pain is to indicate injury. If we don't have pain, we will not understand that there is some injury to that part and that has to be addressed and that has to be paid attention to. And if you don't pay attention to it, that part can decay, it can get further damaged, it can cause further issues, it can even cause death of that person. So it is a very basic necessity to stay alive that you understand there is an injury that has happened, and pain is the way by which the brain understands that there is injury. The second use of pain is to activate reflexes. So the moment you have pain, it's a very unpleasant sensation. So what is the first thing that you do is to react. You take yourself away from the pain. Like for example, in this photo, the girl is touching the cactus and she experiences pain and she immediately recoils. So this reflex is activated because that pain is inducing a very unpleasant sensation in the brain, and the brain is reacting to the pain, which is very essential. Third is to promote tissue healing. So when pain happens, there are a flood of neurotransmitters, flood of hormones, inflammatory cytokines which come into the picture. And their job is to first get rid of whatever is causing the injury and then slowly start the tissue healing process. So if these inflammatory markers and these cytokines, these white blood cells, platelets don't come in, the tissue healing will not be promoted, right? So pain is the first thing which eventually cascades into these actions in the body. And lastly, to facilitate avoidant behaviors in the future. This is very important. Pain is a learning process of the brain. So if something has generated a sensation which is this unpleasant, you will try to avoid it at all cost in the future so that you don't get hurt again. Now, this can work very well for physical pain. Like, for example, you won't touch the cactus again. All right. Or you will not go and, touch a flame or fire. But when it comes to emotional pain, which we will see that will also cause physical pain, it's not as simple as trying to avoid things. It's much more complicated. But anyway, so this is the purpose of chronic pain. Sorry, acute pain. Now, what happens in chronic pain? Now, the medical sciences have said that chronic pain is a disease and it has no real purpose in our body and it has to be treated. Why? Because it lasts for more than 3 months, um, and it continues even after the tissue healing process has happened. So, like if you had a fracture, in all possibilities, by 3 to 4 months, the fracture has healed, but the pain sometimes still persists. It interferes with daily living. Anybody who is suffering from pain can understand how debilitating it is if they cannot plan their day. They don't know how this day is going to be, when the pain is going to come, how much pain is it going to give me, what other activities will I be hindered from doing. So it interferes with your daily activity, which is not what we want. And it also makes a person dependent on other people, which causes an emotional baggage as well. It causes mood changes. It can cause depression, suicidal depression in some cases as well. It can cause anxiety. It can cause worry. It can cause fear. So, mood changes. And lastly, it can indicate that there is a chronic inflammation which is going on in the body, which has not been addressed, right? So, I won't agree completely that chronic pain is useless. The chronic pain in a lot of cases points out to something that has to be corrected in that person. And the unfortunate part is modern medicine does not go and correct the cause, but just tries to put a balm over it. They give painkillers, they give, all those things. They give muscle relaxants, they give anti-anxiety medications, they give all of that, but they don't address the cause of the pain. So this is the beef I have. This is the problem I have with today's modern medicine treating pain. They treat the pain as a symptom. They don't consider that pain is, giving us a bigger signal of something which is going on deeper in the body, which has to be addressed. So just a very basic understanding of how pain is communicated in our body, whether it be an injury or an internal pain or an infection or an inflammation, whatever it is, the part that is getting affected, it sends signal to the brain through the spinal cord. It goes to the brain and it gives a signal that there is something that is causing injury in this part. Now, once that has been addressed, either by removing the stimulus, like going away from the thing, or by giving medications and other things to reduce the inflammation, the brain then sends inhibitory signals to stop the pain. Now, this is very important to understand because we are going to talk about a concept in which these inhibitory signals don't work and the pain persists and continues to stay even after the problem has been resolved. All right, so this is a very basic, crude understanding of how pain is managed or communicated to the brain. So, what makes the pain chronic? So, what makes the pain go from acute to chronicity? The first thing to understand here is it could be an intrinsic issue. Like, for example, if somebody is suffering from arthritis, whether it be rheumatoid arthritis, osteoarthritis, or suffering from IBS, they have got an internal inflammation which is going on, which is damaging some organ. It could be the joint, it could be the intestines, it could be the brain. So, something is happening in the body wherein there it's causing an internal damage, and this internal damage is letting the pain persist for a long time. So that is the first reason. Second reason is muscle tightening. Now, anywhere there is pain, the first reaction, it is a very subconscious reaction that your body has, is to tighten the muscles so that it protects the internal organs. Like, for example, if you have a knee pain, all your muscles around the knee are going to get tightened. And this won't even happen consciously. You won't even realize that these muscles are getting tightened. All right. And that is one reason. So there is inflammation and the muscle is getting tightened. But there are other reasons for muscle tightening. For example, if you are a person who has a lot of stress, a lot of anxiety, a lot of worry, and when you actually try to notice, you will notice that you are clenching a lot of your muscles, which is why stress can cause chronic pain. All right. So second reason why the pain is chronic is that there is constant muscle tightening, which is not addressed. And once there is constant muscle tightening, there is going to be pain in that part of the body. Third, very important reason is central sensitization. Now, in the previous slide, I just told you that sometimes the inhibitory signals doesn't work. The brain is not able to stop the inflammation that is going on, stop the pain that is going on. So in this, what happens in people suffering from chronic pain over a long period of time, say 6 months, 1 year, 2 years, the spinal cord as well as the brain undergoes anatomical and physiological changes, wherein the pain just persists. So unless the central sensitization is corrected, and we're going to see how we can do that, that pain is never going to go. What amount of medications you take, whatever you do lifestyle changes, you do this, you do that, it's not going to go because the brain and spinal cord have changed the way they function, right? And this happens very, very commonly with a lot of conditions, and especially irritable bowel syndrome, fibromyalgia, depression and anxiety associated chronic pain, as well as post-operative pain and sports injuries. So this happens very commonly in these conditions. So they have to be addressed. And lastly, psychosocial. Now, pain is something which debilitates a person and brings in a lot of fear. The first fear that a person gets it, am I going to die? Or am I going to suffer like this for the rest of my life? So these are the questions that keep running over and over again in people's mind when they suffer from pain. And this fear, this fear of unknown, fear of the future, fear of what is going to happen can lead to psychosocial pain, wherein the pain is magnified because of anxiety. Okay. So what happens? How does that happen? So let's say, for example, if you have lower back pain, the first thing you're going to do is have less movement. You will try to give it less stress, not bend over too much, not sit down, take all the precautions. And slowly, slowly, when you're doing less and less movements, you're putting fear in yourself that, oh my God, if I'm sitting in this rickshaw is going to bump and I'm going to feel pain. There is it. The anxiety has come. Your pain has already started even before you have stepped into the rickshaw. And then slowly, slowly, as I said, brain changes and nerve changes take place, where your brain and your brain tries to, look for signs that what is going to increase my pain. It's going to become hypersensitive. All right. And once that happens, it's going to further increase the pain. So this is a pain fear cycle which maintains the chronicity of the pain, which has to be corrected. Okay. So how do you do an integrative approach to chronic pain? The first step to that is to identify the cause. As I said, the pain is only a symptom, the cause can be multiple. So we have to identify and treat the cause properly. So I'm going to just go through some of the causes of pain, general causes, and as a part of the program, we are going to keep some presentations as well. And in those, I'll be going into detail about the causes of pain. So the first cause is autoimmunity. So which if you are suffering from any autoimmune condition, psoriasis, lichen planus, arthritis, rheumatoid arthritis, fibromyalgia, SLE, whatever be it, even Hashimoto's thyroiditis, there is a constant inflammation going on in the body in different places. And this can maintain the pain. So the autoimmunity has to be corrected if autoimmune is the cause for the pain. Second thing is food. Now, food recently, in the last 10 to 15 years, there has been so much research on gut health. And we understand there is something called as food sensitivity, which is very different from food allergy. So a person may not present with vomiting, nausea, and loose motions after eating something, but they can present with increased pain. I have a patient of psoriatic arthritis who told me, I have observed whenever I eat wheat products and maida products, my arthritis and psoriasis flares up. This is an observation which he has made. I did not even ask him about these things. He told me these things. So people are very sensitive. And when you ask them, they understand that they have realized that a lot of common food items can trigger their pain. Third, posture or injury. As I said, post sports injury, any injury actually, the pain can persist. And posture is another very important thing because we are living a life where we are very sedentary. We are working, sitting in one place, looking at the screen. So ergonomics is a huge thing, which a lot of these corporates have taken up, but it's not enough, and it is causing a lot of pain in a lot of people. Fourth is metabolic. So metabolic is basically people who are suffering from hormonal imbalances, especially diabetics, as well as PCOS. So these are the two main conditions where we see a lot of pain. So anybody who is diabetic knows that diabetic neuropathy is a big problem. It causes a lot of pain, lot of burning sensation, unable to walk, and lot of discomfort to the person. Stress, as I said, when somebody is stressed, they automatically tense up without even understanding that they are tensing up. So stress is one of the main causes of it. Stress leads to a lot of things, lot of other diagnoses which can cause pain. That is one way. Second way is stress directly causing musculoskeletal issues. Endocrine disruptors. Now this is a huge topic to discuss, but just to glance over it, endocrine disruptors are certain chemicals specially found in plastics like BPA and bisphenol, which can mimic hormones and cause hormonal imbalances in women, mainly in women, but it also causes in men sometimes. So these endocrine disruptors lead to inflammation, lead to gut, bad gut health, bad hormonal balance, and eventually can lead to pain. And heavy metals. Now, we are unfortunately living in a very polluted environment, and we are being exposed to lead, arsenic, so many metals that we don't even know. And which is why heavy metal detox is another therapy which actually works for some of the patients, uh, especially if we know the link. Like if we understand, for example, they have found out that people suffering from heart disease usually have lead toxicity and cadmium toxicity. So when you understand that, these heavy metals directly cause these links, so you can, do a detox therapy to flush out these metals from the body, and the patient actually starts feeling better after the process, right? So these are some very broad uh, causes for chronic pain, right? So now going further, what is the second step? So now we identified the cause. Now, what do you know next for the cause? So obviously, we'll try to work on the cause. So we'll try to reduce the inflammation. For example, if it's an autoimmune condition, we try to reverse it, reduce the autoimmunity. If it is related to sports injury, we do things for that. Like as I said, if we understand that it is because of heavy metal toxicity, we try to detox the heavy metals. So, what are the things that I will be doing as part of this program? That which is what I'm going to discuss mainly. One is homeopathy, works very well in many conditions. I have used it successfully in a lot of chronic pain patients, and it works at par with allopathic medications or modern medicine sometimes, and they can taper down their painkillers and all that, because painkillers do cause a lot of harm in the long run. The second tool which I use is medical cannabis. I have had a talk with Reach itself a couple of weeks back, so you can go there, access the talk on their YouTube channel and see the details. But I do use a lot of medical cannabis for chronic pain patients, and the results are really very good. The third tool that we're going to offer is yoga and Yog Nidra. So Yog Nidra, which Swati is going to take up in the second half of this presentation, so I'm not going too much into it. Fourth is an anti-inflammatory diet. So as I said, food is a very big component of autoimmunity as well as chronic pain as well as gut health. So anti-inflammatory diet becomes a cornerstone or a center stone for treating chronic pain, which will also be discussed when you do the one-on-one consultations with me. Next is to address sleep issues. It's very surprising to see that a lot of people with chronic pain have sleep problems, and what is even more surprising is that it's not the pain is causing sleeplessness, but the sleeplessness started even before the pain began. So reduced sleep increases cortisol levels. It decreases the repair mechanisms in the brain. It causes reduction in the parasympathetic nervous system, causes so many changes, hormonal changes in the body, which can finally lead to chronic pain. So sleep in itself has to be addressed when we are addressing pain. Herbs, there are like, so herbal medicine is a huge thing. So in India we have Ayurveda, there is traditional Chinese medicine, there is African herbs, there are American herbs, there are so many herbs that are available. And it's the materia medica of herbal medicine is huge. But there are some herbs which are commonly available in India, which are very anti-inflammatory, which can be used for specific, reasons, specific diagnosis, like for arthritis or for psoriasis, etc. So those herbs, when you integrate it with your treatment plan, it gives immense benefits. And lastly, anti-inflammatory lifestyle. So most of the diseases we see today are because of wrong lifestyle. So we have too much stress, we work too much, we don't sleep enough, we don't relax enough, we don't unwind. So all these things contribute to our condition that we have today. So it has to be addressed in a very holistic manner. There is no way that one pill can cure every ill. It's not going to happen. So it has to be a very integrative approach. Different modalities have to be integrated uh, at the same time to actually see the benefit. All right. The third thing that you can do, that you have to do in chronic pain, is learn to relax your muscles. So as I said, muscle tensing is one of the main reasons for why pain persists. So learning to relax the muscles is very important. This can be done in many ways. You can do acupuncture, and whatever medicines also I said, like cannabis, homeopathy, herbal medicine also helps with muscle relaxation. But other than that, what you can do is acupuncture, massage, regularly doing yoga, as well as any physical activity for that matter, cold showers and hot packs. So these are the certain external modalities that you could do that can help you with the pain. And lastly, retrain the brain as well as the pain pathways. Now, this is very important. As I said, central sensitization, wherein your brain and the spinal cord undergoes permanent changes, causing this pain to persist even after the inflammation has gone, even after the fracture has healed. So you have to retrain the brain to not feel the pain. That is a very important aspect of chronic pain management. So there is a saying that neurons that fire together wire together, right? So if your brain has associated, for example, it has associated evening, like the sunset, with pain, every night, every evening when the sun sets, you are going to experience pain because your brain has associated that. So you have to disassociate these kind of associations which the brain has formed, and it's not easy, but it is definitely doable, right? And in the next section, Swati will talk more about how we can manage this rewiring and restructuring of the brain, which is a big part of our program. All right. Thank you so much. And I'm going to hand over the presentation to Swati now so that she can continue the last part of the program.
Hi everyone. Apologies in advance. My throat is horrible. My voice sounds a bit off. Okay. So we would often wonder that why we are talking about yoga when it comes to chronic pain. And let's start with what is pain. According to yoga, pain is anything that causes fluctuations to the mind. Patanjali says yoga is chitta vritti nirodha, meaning what? Cessation of the fluctuations of the mind. So whatever causes fluctuations to the mind causes pain. Now, this pain can be anything. Pain can be mental, emotional, physical, physiological, or even spiritual. Whatever causes this being suffering can be categorized as pain. Now, pain can also be anything and everything that doesn't allow you to function to your fullest capacity. Right? So you have physical pain, emotional pain, spiritual, mental, social. By being with other people also you endure pain, and biological pain. Things that happen to you just by the nature of it. Let's further categorize into what type of pain. So first is muscular tension. You can categorize pain in terms of tension. First is muscular tension. So muscular tension is that which is related to the body itself, the nervous system, and the endocrine imbalances. Second, emotional tension stems from the various dualities of life, like success, failure, hot, cold also, happiness and sorrow. We often fail to recognize them and we repress them. That is emotional tension. And the third is mental tension. Tension as a result of excessive mental activity. All the experiences that are registered in our consciousness are accumulated by the mental body. So from time to time, we end up exploding, affecting our body, affecting our mind, our behavior, and our reactions. So now, how do you know you are in pain? Sometimes we don't know, right? But we have to start assessing our pain. First, figure out where is the pain. To figure this out, the first step actually is acceptance. Are you in pain? Go within yourself, ask yourself this question first. Are you in pain? If the answer is yes, ask yourself next, where is the pain? Okay. For this, it helps to know if it's a muscular pain, emotional pain, or mental pain. Okay. What is the origin of the pain? It could be a physical pain which is getting reflected in your mind. It could be a mental pain which is getting reflected in your physical body. What type of pain is it? Is it a chronic pain? Is it acute pain? Is it pain when only certain situations happen? Is it pain when certain movements happen? And how much is the pain? We need to learn to put our pain in a gradient of 1 to 10. Put it on a scale. We consider everything as chronic pain. Even if you have a headache for 10 minutes, chronic pain. So this is where, like Dr. Shruti said, the neuroplasticity of the brain comes in. The neurons, when they keep firing about the same pain again and again and again, you would constantly keep feeling that pain as if it is occurring to you chronically. So what is the solution? How do we tackle this? First step, understand our pain. Okay. Where is it coming from? Like we did in the previous system. So once we understand that we are in pain, then only we can understand our pain. Second, to create new neural pathways. How do we do this? For example, if you put your hand in hot water, your brain sends a signal. The neurons send a signal to the brain saying, oh, it's hot. The first second it will. After 2-3 seconds, that impulse stops. So then you put it in cold water, it will again send a new impulse. But if you put your hand in hot water constantly, that impulse stops going. So there is a neural pathway that has stopped producing newer impulses. So we need to create new pathways which are able to differentiate and then tell the brain, you are not in pain. Difference between one impulse and multiple impulses just firing without any cause. Third is to reduce the fight or flight response. Now, what does this fight or flight response do? It's your body's way of knowing when to run away from danger. Now, this happens anytime the body mind feel that they are getting attacked, right? The first response for the flight or fight response is muscle tension. When somebody punches you in the gut, what happens? Our entire core gets tightened. So first thing is, how do you tell the body that you are in a safe space? Once there is a trigger, how do you tell? Reduce your cortisol, reduce your adrenaline. So you need to teach the body these things. And what happens when you teach the body these things? It then triggers the parasympathetic nervous system. What does the parasympathetic nervous system do? It tells the body, calm down. Right? How do we bring about these 4 changes within the body? The first and foremost step is mindfulness. We already tackled that in a very small way by knowing whether or not you are in pain. That itself is mindfulness. What do I further mean by that? If you have, let's say, twisted your right ankle and you continue walking because it's barely paining, and you slowly start shifting your weight to the left leg, what happens? Your left knee is going to start paining. And you have forgotten that it's because of your right ankle that your left knee is paining. So first step was what? Addressing the ankle. Accept you are in pain. Do remedies for the ankle. Right? Second step then comes so that you stop putting weight on the other leg also. Treat them equally. Third is knowing which pain is good and which pain is bad. Okay. Let's continue with this example. If you have twisted your ankle, that pain is bad pain. It's paining. But now, if you stop using your right foot itself because it is paining, what is going to happen? It's going to continue further up and cause complex pain. Calf pain, transfer to knee pain, transfer to thigh pain, going up to your sciatic. So when you are reversing it, when you give movement to it, it's going to pain, but that is good pain. So mindfulness in differentiating good pain and bad pain, mindfulness in knowing what is pain. Third, mindfulness in relaxing. Okay? When you even hold something, you are using a complex set of muscles, right from your shoulder to the upper arm, to the lower arm, to the wrist. When you let it go, what do you let go? Fingers. Do you let go of the stress here? No. So over time, this stress accumulates slowly, slowly. This is how you end up getting entire body as a tight, massive chunk of just tight muscle. So from mindfulness, we come to asanas. Asanas help release this muscle tension. One. Second, if you have an injury, how do you rehabilitate these joints, muscles? How do you push through the pain to create again new neural pathways where the body is able to recover from it? Now, you can't live lifelong by not moving your leg if you have injured your leg. You need to teach it better ways to come about. Third, pranayama. What I mean by that is even knowing how to breathe properly. The moment you breathe from your abdomen, you trigger the parasympathetic nervous system, you reduce your fight or flight response, you reduce your cortisol, you reduce your muscle tension. So knowing when to do this. So you have to recognize, oh, I am in tension. I need to breathe from the abdomen. So then you have something called somatic tracking. Now we'll go in detail on what this is in the course. But to give a brief idea, somatic tracking is a kind of mindfulness method where at the lowest pain point, you are able to go to the depth of your pain. In terms of what we spoke in the beginning, what is causing the pain, where is the pain, how much is the pain. So somatic tracking slowly helps you bring awareness to the pain in such a way that you are able to then dissociate from the pain and create newer pathways. And the last one is Yog Nidra. What is Yog Nidra? Yog Nidra, the current Yog Nidra that we use was developed by Swami Satyananda, the disciple of Swami Shivananda, as a technique for ultimate body relaxation. Okay? So Yog Nidra comes from Tantra Yoga, and has been adapted so that we can understand what is being said. Yog Nidra is a type of guided meditation which is done lying down as opposed to seated meditation. And it is purely to bring physical relaxation and rewire brain pathways. So they have done enough studies to show that Yog Nidra actually changes the pathways of the neural networks, create new ones, and those sustain over a period of time. So Yog Nidra has certain sections. The first is body relaxation. Each and every part of your body is relaxed consciously. Second comes to pranayama. So how to trigger the parasympathetic nervous system step by step. And the third is the most important part, which is your visualizations. That is the one which takes you to the innermost part of your chronic pain. It shows you where your pain is. Nobody is even forcing you to do it. Your own body guides you to look at the pain, to see where it is, to see the memory from where the pain came, and to consciously change it. So the difference between Yog Nidra and, let's say, hypnosis is, in hypnosis, the conscious part of your brain is completely shut off. In Yog Nidra, you are completely aware, completely conscious, and completely in control of where your mind travels. So what it says is to take your mind to the pain so that you can get over it. And this is a journey of 3 to 6 months to even get to the root of it. The biggest thing I would say with chronic pain is be patient with the process. You gave it so much time for the pain to develop. Give the process also that much time to get rid of. What we want to give away from our course is the concept of just letting go of pain, letting go of stress, letting go of tension, letting go of things that no longer serve us. We can do through asanas, through breathing, through medicines, through homeopathy, through diet, and through Yog Nidra. Why we are starting this course through Yog Nidra is until we learn that our body is in tension, we will never learn to relax. Till you attempt asanas, first relax the body. I cannot stress this enough. The amount of pain we go through just by muscle tension is enormous. Thank you.
Thanks, Swati, and thanks, Dr. Shruti. So any closing comments, Dr. Shruti, before we take the questions?
Yeah, so lovely presentation, Swati, loved it. And as she said, the essence of this is that be patient in your healing process. Miracles don't happen in one day. It happens in increments. And if you are patient enough, you can see that big change in maybe 3 months or 6 months or 1 year, depending on, what the problem is. But it will definitely come. Okay, so I think I'll leave it at that and we'll take the questions. Swati, you can stop sharing your screen. Okay. Naresh, what about back pain? Okay. Oh shit, wait. Where did that question go? Back pain, slip disc also gives chronic pain. Yes. So back pain is a very, very big chapter in itself. But I'll tell you a very interesting study which they did. It's called as the Boulder Back Study. You can go and even Google it. They took some 200 odd patients with chronic back pain, which they have been suffering for over 8 years. And they have all been addicted to painkillers, taking even morphine, which is an opium extract, for their pain and not getting any relief. And they found out that 96% of those people had no structural abnormality. They had absolutely no problem with their back, but they were suffering from pain. And there was another study where they saw that people with lot of pathological back problem like slip disc, sciatic nerve compression, even degeneration of the vertebra had no pain. They were going on with their life as if nothing has happened. So this makes us wonder that what is this pain actually suggesting? Because there is no correlation between the pathology and the pain. So yes, back pain is different, but slip disc has to be corrected, which can be done with yoga very well, with medications also, and as well as correcting the posture and all of that. But once that is corrected, the pain persists in most of the people. Again, because of all the reasons we just spoke about, because the brain plasticity has happened, because there is fear, you have started tensing the muscles of your back because of the pain that you've had so far. And that leads to this chronic complex pain syndrome, which has to be addressed in a holistic manner, right? What is autoimmunity? Okay, so autoimmune conditions are conditions where our body produces antibodies against its own self. It destroys its own self. For example, in our autoimmune arthritis or rheumatoid arthritis, our body produces antibodies against the joint capsule. All right. In Hashimoto's thyroiditis, our body produces antibody against the thyroid gland and it starts destroying the gland. Similarly, in psoriasis, it's antibodies against the skin and the keratocytes. So there are more than 100 different autoimmune conditions. We don't even know about a lot of these conditions. Even in even in research, we don't know too much about them. But this is the new epidemic that we are seeing now. Okay. Next. Thank you, Ishmeet and Dr. Reva, for the comments. Thank you. Depression and anxiety is also chronic pain. So it's not that, but a majority of people who have depression and anxiety suffer from chronic pain. Now, it is both ways. Maybe the chronic pain started first and then led to depression and anxiety, or the depression and anxiety started first and eventually led to chronic pain. But these two conditions coexist very often. And which is why the yoga nidra which we do and the different holistic things which we do also treats the anxiety and depression, because they are all interlinked. Our body is one. You cannot separate the diseases based on diagnosis. Mr. Kalyan Rao, thank you so much. Recording will be made available. You can get in touch with Reach and they can help you with that. Mr. Sanjeev Singh, he wants to consult. Please, Mr. Bala will share the contact details and you can get in touch with the Reach team. Okay. Yes. Swati, there is one question. Maybe you can take this. How different is Yoga Nidra from regular sleep? And Yoga Nidra versus Shavasana?
So when you sleep, the brain emits certain frequencies. It's how the brain shuts down when you go to sleep. It is still functioning fully, but it goes through certain wavelengths which govern your, let's say, sleep, your REM, rapid eye movement cycle, and all those things. So when you do Yoga Nidra, it functions on a higher frequency. It functions on the alpha level. They found this through lot of research and lot of papers have been published on this. So the part of the brain that is functioning during Yoga Nidra is very different from the part of the brain which is functioning during sleep. When you do it in Nidra, the consciousness is very high, whereas compared to sleep, there is no consciousness. So even when you go through the different cycles, the different sleeps, the different dreams, you are unaware in sleep, but in Nidra, you are completely aware of all of it. You are the one who is watching it. So it's like a conscious dreaming where you are kind of guiding the dream. And it's different from Shavasana because Shavasana is a smaller cycle. It doesn't drop the brain activity level to that low where you are able to go down to the alpha level. So Shavasana doing is very different from Shavasana actually being able to do. Right? So it's very easy to say relax your body. Do you truly relax your body? You will know after a Yoga Nidra session if you have actually relaxed at a Shavasana session or not. So that level of relaxation where you are completely, you have left the body in terms of physical awareness, that you need to do. If you're able to do it through Shavasana, also fine. Can you be the Shav is the question.
What is somatic tracking? Umaid, it's a very big topic, and we are going to cover it as part of the program. So you will get you'll get videos on how to do somatic tracking and guide you to do it by yourself. It will be very difficult to cover it in this session. Like as Swati said, somatic tracking basically is to get to the bottom of the pain and to know your pain consciously. And it's a process that has to be learned basically. When does the course start? Naresh, I think the Reach team can give an answer to this, but anybody who is interested can join immediately and we can start the process. Dr. Reva said, I'm 82 years old, having grade 3 osteoarthritis, lot of pain around it. Yes, yes, yes. Definitely osteoarthritis. See, a grade 3 osteoarthritis cannot be reversed, unfortunately. Had it been grade 1 or grade 2, I would have said, yes, reversal is completely possible. But a lot of things can be done to manage the pain, including Yog Nidra, because you see it's grade 3 osteoarthritis, so you must have been suffering from it for at least 15 years now. So your entire knee joint has become tense. So you have to learn to relax the knee joint also, at least when you're at rest and when you're asleep. So all these techniques will help you gain that and will help you with the pain, definitely. Um, Can it work for senior immobile patients? Of course. Why not? Yog Nidra, the whole concept of Yog Nidra is that you can do it lying down. It is very comfortable. Even I can't sit in meditation for more than 20 minutes. I get,
Yeah.
leg cramps. But this is so beautiful that even somebody who is lying down, who is bedridden, who is suffering from pain, can benefit from this. Definitely.
The beauty of Yog Nidra is you need not know the language, you need not do anything for it. The entire science is doing nothing.
Yeah.
And you will still achieve everything through it.
Mr. Ramachandran has asked if I'm already in consultation and medication, how can I switch over? It's very easy. You can just get in touch with our team and you can get a consultation with me. So I'll just quickly explain how the process works. So there'll be first one-on-one intake consultation with me where I'll assess your case completely. And after that, there will be weekly Yog Nidra sessions with Swati, which is in person or live, you can say online. And you'll also get recordings to do at home. Every week is going to be different because she's going to guide you through the process. So we'll start like from basic and go deeper, 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 and deeper. And with me, you will also have follow-ups once in a month. So I would recommend please do a 3-month or a 6-month program with us, because as I said, chronic pain is not something which is, just goes away. You have to, be with the healing journey. You have to give it time and effort and your, faith. That's what I would say. And Mr. Ramachandran, once you start consulting with me, I can also taper down your allopathic medications once you get better, because that is what I do with most of my patients. So the ones that come to me are already on painkillers, they are on very strong opioids and all of that. And once we start our treatment, depending on the progress, we gradually taper down the medications after a while. Yeah, so don't worry about that. What about degenerated spine? Mr. Umaid, it's a very, very broad question. So if it is degenerated, of course, it cannot be completely reversed, but it depends on the condition. Like, I don't know what condition it is, but whatever be the condition, as I said, you can get benefits from the medical line of treatment, which we are doing an integrated medical line of treatment. Secondly, the Yog Nidra will help you relax. So that will help in the what improving the muscle spasm around the spine and help you with the pain that way. How to heal a person who is non-verbal autistic, who is suffering from chronic headache in the past 3 years? Yes, autistic, Mr. Anup, autistic kids are a different ball game altogether. They can also do Yog Nidra. It's not that they can't do. In fact, it will help them. So if you can just figure out a way to, get like they listen to music, because I know autistic kids listen to music. So it's something like that. If you can put them in the habit or where they have to listen to this for 20 minutes or half an hour or 1 hour before they go to sleep, it can come into their habit, and it can be addressed. Yeah. Mr. Raj has asked, can cannabis help in autoimmune disease? Absolutely, yes. I have reversed, or rather, I have seen cases in my practice where early onset of rheumatoid arthritis and mainly rheumatoid arthritis have completely reversed with cannabis. And even in later stages, like, where the joint destruction has happened, cannabis helps in a big way with not just pain relief, but it has got multimodal action in the body. You can access our my presentation on cannabis with reach, which I did a couple of weeks ago. It will give you more details on how it helps. Mr. Govardhan saying, I have overcome lumbar compression with yoga and yoga nidra, but I am not able to get relief from frozen shoulder. Uh, Mr. Govardhan, so frozen shoulder is a condition where you have to do rigorous physiotherapy. There is nothing else which works, unfortunately. Because it is where the joint capsule has become frozen to the joint itself. So it's like, basically, imagine that your shirt has stuck to your skin. That is what has happened. And so it restricts movement of the joint. So through physiotherapy, and this has to be physically done, it cannot be done online and all, because the way they move the joint, the way they pull it, it has to be done physically. And it pains a lot. So you have to take some painkillers or something to help you with the pain in the process. But
Yeah, and
1
once
month,
you're
yeah,
through that, then you can shift
yeah.
for further movement, increasing mobility, increasing range, then you can come to yoga and yoga nidra. But
Yeah.
for the initial phase, you will have to go through the pain.
Yeah.
Like I said, this is the good pain. You need to push through it.
Yeah, yeah. Thank you, Rajeshwari, for the comment. Thank you so much. Miss Usha, she's saying, I have controlled 4-year knee osteoarthritis grade 3 only with exercises without meditation. That is amazing. That's amazing. If you have done it, good for you. It's amazing. Yeah. Thank you, Pinakin ji. आप आए presentation के लिए. Ms. Geeta says, I have Hashimoto's, psoriasis, and sciatic pain. Will this course help me? Definitely, it will help you. And since it's psoriasis, you might have to take treatment a little longer. So we have kept the basic program as 3 months. But for somebody like psoriasis, you also must be knowing it's not very easy to completely reverse it quickly. So definitely, please come in. I can help you with all of these issues.
This one by Sadhana Singh. How to get rid of tailbone pain more than a year? Suffering from it by prolonged sitting and traveling, it increases a lot. So you will have to do yogasanas for this. And there are particular yogasanas that you will need to do in order to tackle this. If you can't, if this pain prolongs, you might end up getting a pilonidal cyst or chronic sciatic pain, or can further travel down to knee or uh, thigh pain, all that. So you will have to address this through yogasanas.
And I think I'll add here, you can take personalized yoga classes also with Swati, and that helps more. Like, people think that doing group yoga is great because it's cheaper and you'll get done. But the way the personalizing helps, especially in yoga, because everyone's problem is different, where they are at in terms of physical flexibility and muscle strength is very different. So at least for the first 2 to 3 months till you become a yoga practitioner, like as in a person who does yoga regularly, I think a personalized session helps more than a group session, and then you can shift to a group session. So you can get in touch with Reach and you can set up sessions with Swati. Mr. Kalyan Rao has asked, does cannabis help for autistic kids? It helps for a lot of autistic children, not all, I would say. Some autistic kids aggravate on cannabis, but it helps at least, I would say, 80% of the kids. You can get in touch with Reach for a consultation if you are interested. Thank you. I think we have gone through all this thing. Yeah. I think Bala, you can take over. We have finished all the questions.
Thanks a lot, Dr. Shruti and Swati, amazing presentations. And as I mentioned in the beginning, this program has given completely a new perspective for all of us about how the chronic pain could be handled through a completely, and probably this method are new to us. So this is actually a paradigm shift for all of us in the program. Thanks a lot for coming together and organizing this. So as you mentioned, Dr. Shruti, I have just displayed the program plan here, the structure. So for the benefit of everyone, it is scheduled for 3 to 6 months, depending on the kind of challenge you are facing. And then it starts with the preliminary intake consultation with Dr. Shruti, and there will be 2 follow-up consultations. And then there will be regular lectures on the chronic pain. The lectures will talk about understanding the pain, understanding the causes and the practices, diet, activities. And then Swati will take you through weekly yoga nidra sessions. Each session will be unique. It is not a repetition. And during the course of the program, you'll also get access to the online training materials. So this is all. And so please stay tuned with us. We will get back to you with the detailed program content and connect with you one-on-one. We will send you the program structure in the WhatsApp and email. So then you can also contact us in the coordinates given here. So I'm just leaving this slide for a couple of minutes so that you can take a note of it. Great then. So yeah, any final comments, Dr. Shruti and Swati?
No, I think we've covered everything. Yeah. Thank you so much for attending, and it was lovely talking to all of you, and so many questions. It was very interactive, and yeah.
Great. Thanks everyone for putting your time and being very active in the session. So we will connect with you soon and take forward the engagement further. Thanks a lot once again. Have a great evening.
All right. Bye. Thank you.
Bye, everyone.
Well, I'll leave the number for a couple more minutes.
Yes.
We'll close the session, Bala.
Okay, Naresh, then. Bye.
Yeah, bye.
I'm closing it.